Good day, Nana. My name still remains Akosho Johnson Adewale, your e-tutor for PHA 302. I welcome you to today's lecture on study section 7 of pharmacodynamics and chemotherapy 2. And the last time we were able to look at study section 6, which deals with cardiovascular agents 2. Today, our focus will be on cardiovascular agent 3. So, and without wasting much of our time, uh, this will be our learning outcome for the study section 7. That at the end of today's study section, you should be able to discuss digitally drugs, origin and mechanism of action, describe diuretics as a cardiovascular agent, discuss nitrates and their examples, describe an overview of peripheral adrenergic antagonists, and lastly, we'll be looking at vasodilators and combinations of drugs as a cardiovascular agent. So, and by way of introduction, in recent years, the prospect for the cardiovascular disease pharmacotherapy seems to have hit the wall with multiple high-profile trial failures and declining industrial interest. Reasons for such predicament might include an intensive regulatory environment, a competitive market, elevated bars of existing medicine, further innovations, and the increasing cost of mega trials. However, the most important and intrinsic reason comes up to the lack of mechanistic understanding of drugs action and the complicated etiologies. However, this study section will introduce you to the concluding aspect of cardiovascular agents and the mechanism of action. So the first group of drugs that we'll be looking at is digitalis drugs. Digitalis drugs. Many drugs, digitalis was originally derived from a plant. In this case, the foxglove. Digitalis has the primary effect of strengthening the force of contraction in weakening heart, but it is not a cardiac vitamin that can make a strong heart stronger. So what that simply means that talking about digitalized as a group of drugs that act on the heart does that it strengthens the force of contraction of a weakening the heart. So and take note of this very uh, phrase or statement that says it is not a cardiac vitamin that can make a strong heart stronger. So it's not a group of drug or kind of drug that you use that you want to make your heart to be stronger. So can only be using it can only be used when there is weakness of the there is a disorder that brings about in the heart. So and you use that to reinforce or to strengthen the force of contraction. So it is also used in the control of atrial fibrillation. The most commonly used digitalis product are digoxin and digitoxin. And I want to believe that we are all familiar with this group of drugs and how it is being used. So drugs penetrate all body tissues and reaches a high concentration in the muscles of the heart. Its molecules bind with cell receptors that regulate the concentration of sodium and potassium in the space between tissue cells and in the bloodstream. So these two minerals determine the level of action, a potent stimulator of heart contraction within muscle cells. So that's the major focus of these two drugs. That these two minerals determine the level of calcium, a potent stimulator of heart contraction within the muscles cells. So digitalis preparation acts by increasing the amount of calcium supplied to the heart muscles and thus enhancing its contraction. Digitalis drugs also affect electrical activities in the cardiac tissue, control the rate at which electric impulses are released and the speed of their conduction through the chamber walls. These two actions determine the two major uses of the digitalis drugs: heart disease, treatment of heart failure, and control of abnormal heart rhythm. Those are the two major uses of digitalis. That is, they can be used to treat heart failure, two, and they can be used to control abnormal heart rhythm. So, digitalis preparation are a major class of drugs used in the treatment of heart failure. By increasing the force of heart contractions, they increase the amount of blood pumped with each. Improved pumping capacity offsets the mechanism that leads to enlargement of the failing heart. A more efficient heart pump may effectively reducing the tendency for fluid retention and tissue congestion. So still on lethal drugs. Lethal drugs can be used to treat disturbances of, particularly the abnormally rapid contraction of the atrial, referred to as atrial or supraventricular arrhythmia, especially atrial fibrillation. So the drugs restore the normal heartbeat either by interrupting the abnormal rhythm or by slowing down the rapid beat to a rate at which effective and coordinated heart contraction are possible. So those are the major mode of action or mechanism of action of these drugs. So we want to begin to look at some of the example of digitalis preparation. Now, number one is digoxin, and this can you can find this with these trade names: Lanotic, Nalosicams, and Lanoxin. So these are the trade names, and these are being supplied in tablet form and elixir, capsule, and injection. So in tablet form, you can find them in those form of 0.125 milligram, 0.25 milligram, and 0.5 milligram. In a capsule form, you find them in those form of 0.05 milligram, 0.1 milligram, 0.2 milligram. And the elixir have 0.05 milligram per ml, 60 mils per bottle. Then the injectable form is in those form of 0.5 milligram in 2 mils, 0.1 milligram in 1 ml. And the description, it is a digitally drug extracted from the leaves of foxglove plant. Slows the artery so that each beat is more effective in pumping blood, which is the main uh, mechanism of action of these drugs. So the effect is that it treats heart failure and corrects some abnormal heart rhythm. So possible side effects are some side effects include tiredness, nausea, loss of appetite, and disturbances in vision. The dosage are 0.125 milligram to 0.25 milligram per day for adults. Then it reduce dosage for children based on weight and age, up to 3 times a day to start and then on the daily. Now, note, check with doctors before combining with any other medication. There are numerous drug interactions. That means these peripheral drugs they can interact with many many drugs or many medications. So people taking digoxin must be carefully monitored because an effective digoxin dose may be near the toxic dose. So still on digitalis, another example is digitoxin. Yes, and these are the two major digitalis. So the trade name for digitoxin are Christo, Christodigene and Porodigene, and it's being supplied in tablet form, 0.05 milligram or 0.1 milligram. Description. So it utilizes drugs from the foxglove plant. From foxglove plant, it strengthens the force of heart contraction. Then the dosage is 0.05 milligram to 0.2 milligram per day. Every every 6 to 8 hours for first few doses, then once daily. Then the other group that I want to look at is diuretics. So diuretics commonly refers to as water spills, lower blood pressure by increasing the kidney excretion of sodium and water, which in turn reduces the blood and the volume of blood. And when there's reduction in blood volume or reduction in what? Blood pressure. So, and this is the major mechanism of action of diuretics. So, these are among the older antihypertensive agents having been introduced for use in the United States in 1957. They are still widely used either alone or in conjunction with other antihypertensive drugs. So we see some of these some of these diuretics, they are either in combination with antihypertensive or they stand solely or alone for use. So diuretics are also highly effective in the treatment of heart failure. There are several types of diuretics which are classified according to their site of action in the kidney. Hazard diuretics work in the tubules, that is the structures that transport urine in the kidney. Loop, and another site is the loop diuretics, and these are more potent than the hazard diuretics. They are so named because they work in the area of the kidney called the loop of LA. So they are usually prescribed, that is, diuretics are usually prescribed when a hazard diuretics proves insufficient or for patients with heart failure or compromised kidney function. A third class is the potassium sparing diuretics. Take note of each of these classes of diuretics. They are very, very important, especially for the purpose of the exam. So, a third class, the potassium sparing diuretics, work in the area where potassium is excreted. Take note. They prevent the excessive loss of potassium that sometimes occurs with hazard. They are most often given in conjunction with a hazard or loop diuretics. So diuretics are highly effective, generally well tolerated, and less expensive than most other antihypertensive medications. They were medication used in all of the long-term hypertension treatment study that demonstrated a marked decrease in stroke and heart failure. So take note of that. So examples of diuretics are the example of the first group of diuretics, that is thiazide diuretics, is clotial, clothalidone. You know, the trade name is Agroton, and it's being supplied in tablet form of 25 milligram, 50 milligram, and 100 milligram. Prescription. It is a hazard diuretic introduced in the 1960s. Removes excess water and sodium from the effect. Reduce fluid retention in people with heart failure, kidney disorder, liver disease, or premenstrual tension, and it lowers blood pressure. Some positive side effect of this hazard that, although uncommon, lethargy, cramps, rash, or impotence may occur. Some of these effects may be caused by loss of potassium, may be avoided by including potassium supplement or potassium sparing agent, of course, because these drugs target the removal of sodium and water from the body. Generally, alongside with the water and the sodium, potassium will equally be lost. So, and for this effect, there will be need for what? Uh, uh, Potassium sparing agent or replacement or supplement of potassium in order for an individual not to come down with what? Weakness or the weakness effects of this drug. So the dosage is 12.5 milligram or 25 milligram to 5 to 50 milligram per day. Note, if potassium loss is excessive and digitalis drugs are also being taken, the side effect of those drugs may be increased. So it interacts with lithium to cause lithium toxicity. That's another important caution or precaution that you need to take note of. So it may prevent calcium kidney stones or help prevent osteoporosis. Yes, that is one of the beautiful effect of these drugs. So it may cause uric acid level or glucose level in blood to increase. That's another negative side of this very particular thiazide diuretic. May cause uric acid level or glucose level in blood to increase, leading to or aggravating gout or diabetes, respectively. It may also adversely affect take note of all these important whatever information. Now, want to look at another another example of diuretics. I'm talking about hydrochlorothiazide. The trade names are Excedrix, hydro, hydrodiuretics. Then they are being supplied in tablet form, 25 milligram, 50 milligram, and 100 milligram. Description. It is a thiazide diuretic introduced in 1958. It removes excess water and sugar from the body. The effect in the body is that it reduces fluid retention in people with heart failure, kidney disorder, liver disease, premenstrual tension, and it lowers blood pressure. The dosage is 25 milligram to 50 milligram a day. Another example is metolazole, and the trade names are Dialo, Microx, Zaruxolid, then, and they are being supplied in tablet form of 0.5 milligram, 2.5 milligram, 5 milligram, and 10 milligram. Then the dosage is 2.5 milligram to 10 milligram per day. Note, met- metolazole, metalazone is longer acting than most thiazide diuretics. So another example, I want to look at the example of loop directives. Remember that these directives are being categorized or classified into three. So the second group is loop directives. I want to look at the examples. And the first one here is a bumetanide, that is bumex. And this is supplied in tablet form of 0.5 milligram, 1 milligram, 2 milligram injection, and also in injectable form of a 0.25 milligram per mil, 2 mils, in 2 mil per ampoule, then, or 0.25 milligram per mil, 2.4 to 10, 2, in 2.4 and 10 mils vial. So description, it is a short acting loop diuretic. So it's a short acting loop diuretic. The effect is that it reduces fluid retention resulting from heart failure, liver disease, kidney disorders, and it lowers elevated blood pressure. And in emergencies, it relieves fluid retention in the lungs. So this can be used in emergency case to get the quick results. So, and the dosage is 0.5 milligram to 2.5 milligram a day divided into two doses. Note, larger doses may be required for people with kidney. Larger doses may be required for people with kidney diseases. Now, the another example of loop directives is a furosemide, that is Lasix, and this is being supplied in tablet form of 20 milligram, 40 milligram, 80 milligram, and we have oral solution of it in 10 milligram per ml, and we have them in 60 ml per bottle, and or 120 ml per bottle. Then we still have injection, the injectable form of these drugs, which is 10 milligram per ml of 4 ml per ampoule or 10 ml prefilled syringe ampoules or vials. Then we talked about the description. It is a short-acting loop diuretic that has been in use for more than 20 years. The dosage form is 20 milligram to 40 milligram per day, divided into two doses. And larger doses may be required for people with kidney diseases. Now, we want to look at the example of potassium sparing uh, diuretics. Potassium sparing diuretics. Then we have the first one here is amiloride. Amiloride, and the trade name is Midamol, and it's being supplied in tablet form of 5 milligram. And the description, it is a potassium sparing diuretic that is rarely used alone. So, and the effects are combined with thiazide or loop diuretics, treat high blood pressure and fluid retention resulting from heart failure or liver disease. Then, the possible side effect of this drug is that if excessive potassium is retained, muscle weakness and numbness may result. This drug also can cause upset stomach, lethargy, or rash. Dosage 5 milligram to 10 milligram per day. Note, it should not be taken in conjunction with lithium. It should not be taken in conjunction with So then, uh, still on the potassium sparing drugs, we have spironolactone. The name is adactone. It's one of the commonest potassium sparing drugs. So, and it's supplied in tablet form of 25 milligram, 50 milligram, 100 milligram. And it is a potassium sparing diuretics introduced in 1959, and it is still, and it is rarely used alone. You don't use it all alone. You combine it with other drug, especially with thiazide. So then, effect combined with thiazide or loop diuretics treat elevated blood pressure, fluid retention resulting from heart failure, liver disease, or a kidney disorder, nephrotic syndrome. Now, and the positive side effects that if too much potassium is retained, muscle weakness and numbness may result. Nausea and vomiting are fairly common. Side effects may also include diarrhea, lethargy, irregular menstruation, breast enlargement in men, impotence, or rash. The dosage 25 milligram to 50 milligram, given to given 3 to 4 times per day. Note, interact with lithium and digoxin. So these drugs, without aspirin drugs, they interact with lithium and so then I want to look at another example. We have tramaterine, that is diarrhea, and it's being supplied in capsule form of 50 milligram and 100 milligram. Description: it is a potassium sparing diuretic introduced in 1964 that is rarely used alone. You take note that all the potassium sparing drugs are not they are rarely used alone. They are used in combination with other drugs or antihypertensive drugs. So possible side effect: if too much potassium is retained, muscle weakness and numbness may result. So it can cause upset of stomach, upset stomach rather, lethargy and rash. And the dosage form is 50 to 100 milligram per day. Note, all of the potassium sparing diuretics are available in combination tablets with hazard diuretics. Examples include diazide and maxicide, which combine tramterine and hydrochlorothiazide, or muduretics, which combines amiloride and hydrochlorothiazide. So these and other diuretics combinations are among the most commonly used medications in the treatment of hypertension. So we want to move to another categories of drugs or cardiovascular agent. This is nitrates. Nitrates. So the oldest and most frequently used coronary artery medication are the nitrate. That statement simply tells us that when you're talking of nitrate, it's majorly used for coronary artery there. So the old and is the oldest and most frequently used coronary artery medication. And nitrates are potent vein and artery dilator. And that's talking about the main mechanism of this group of drugs. This they are potential. They are so potent in vein and arterial uh, tissue, so causing blood to pool in the vein and the arteries to open up, thus reducing the amount of blood returning to the heart. This has the effect of decreasing the work of the left ventricle, lowering the blood pressure. So those are the major uh, actions. Number one is that it decreases the work of the left ventricle, the workload of left ventricle, and lowering the blood pressure. So nitrate may also increase the supply of oxygenated blood in the coronary artery to open more fully, thus improving coronary blood flow. Nitrate effectively release coronary artery spasm. That's another important action of the nitrate. So it releases coronary artery spasm. So they do not, however, appear to affect the heart contraction. Yes. So whenever nitrate is being used, they didn't affect what? Heart contraction. just as you have in the case of digital things or digoxin. So, but this one, they reduce or relieve spasm, and they do not affect the contraction in whatsoever way. So I want to look at the examples of nitrates. Number one is a nitroglycerin, nitroglycerin, and the trade names are deponite, NTG, mini, minitran, minitran, then nitrobid, nitrogard, nitroglay, nitro, nitrolingua, nitrunk, nitrostat, transderm, nitro, then trideal. Then, and these have been supplied in a sublingual tablet form that can easily be dissolved under the tongue in the dose form of 0.15 milligram, 0.3 milligram, 0.4 milligram, then 0.6 milligram. Control release buccal tablets in form of 1 milligram, 2 milligram, 3 milligram. Then we have control release oral tablets in form of 2.6 milligram and 6.5 milligram. Control release swallowable capsule in those form of 2.5 milligram, 6.5 milligram, 9 milligram, 13 milligram. Then we have the ultimate. It's being supplied in ultimate form of 2% or 15 milligram per inch in 1 gram, then 3 grams, then 20 grams, then 30 grams or 60-gram tubes. Oral metered dose spray. Oral metered dose spray is 0.4 milligram spray in 14.49 gram per 200 dose container. Then another, it can be supplied in skin patch, in form of skin patch of 0.1 milligram per hour, 0.2 milligram per hour, 0.4 milligram per hour, or 0.6 milligram per hour. And the description of this very particular group of drugs is that these anti-angina drugs and vasodilator was introduced in the late 1800s. So effect, that means it has been in the system for a long period of time. So the effects are temporary reliefs and prevent angina pains. The possible side effects are headaches, flushing, and dizziness may occur. The dosage of this drug are 2.6 milligram to 27 milligram per day in oral tablet form, then 0.15 milligram to 0.6 milligram per dose in sublingual, and then 1 milligram to 2 milligram per dose when it's been taken with book. Then 1 to 2 inches of 2% of milk per dose or 1 skin patch daily. Note, nitroglycerin interacts with antihypertensive drugs to lower blood pressure. Nitroglycerin cannot be stored for a long period of time without losing its effectiveness. Nitroglycerin skin patch should be used intermittently to avoid the development of tolerance to the drugs. Then we have leaving the patch off overnight is usually sufficient. Another example is isosorbide nitrates, and these are the trade names. So, and they are being supplied in sublingual tablet, they have been dissolved under the tongues. Now we have 2.5 milligram, 5 milligram, 10 milligram. Then we have chewable tablets in form of 5 milligram, 10 milligram. Then we have swallowable tablet that's being supplied in 5 milligram, 10 milligram, 20 milligram, 30 milligram, 40 milligram. Then we have control release tablets. So they have been supplying control release tablet of 40 milligram, then control release capsule of 40 milligram. So description, it is a nitrate vasodilator and anti-angina drugs introduced in the late 1970s. Is a longer acting form of nitroglycerin. Effect, it relieves and prevents angina. Possible side effects: headaches, flushing, or dizziness may occur. Headache, flushing, or dizziness may occur. Less frequently, fainting may occur. Dosage: for relief of angina, 5 milligram to 10 milligram per dose. For prevention of angina, 40 milligram to 160 milligram daily. Still on nitrate. Note, alcohol and other antidepressants may further lower blood pressure. Unlike nitroglycerin, isobalbide, isosorbide dinitrate can be stored for long period of time without losing its effectiveness. Dosage 0.1 milligram to 0.5 milligram per day. Note, reserpine is a component of several combination drugs. Reserpine is also used for some psychiatric disorders. The drugs should not be used by people with a history of mental depression. The use of reserpine in conjunction with digitalis drugs or quinidine may cause abnormal heart rhythms. Take note of that information. And we want to look at another categories or group of cardiovascular drugs, and this is peripheral adrenergic peripheral adrenergic antagonists. The drugs, which are among older antihypertensive agents, lower blood pressure by inhibiting the release of adrenaline or by blocking its effect on the nerves ending. So they work on, they inhibit the release of adrenaline by blocking the effect on the nerve, or they block the effect on the nerve ending. So then they brings about dilatation of blood vessels. They have a sedating effect at high. So when you use all these peripheral adrenergic antagonists in high doses, they can bring about sedative now. Still on peripheral adrenergic antagonists, this remain a major drawback to the continued use of the drugs to treat high blood pressure. That is, because of the sedative effect, high doses. So this has brought a what? A major drawback to the continuing use of the very particular drug to treat high blood pressure. So this is the least expensive of all the antihypertensive medication. In combination with a diuretic, is effective in lowering blood pressure. And the example of peripheral adrenergic antagonists are the reserpine, this sapacil, and it's being supplied in tablet form of 0.1 milligram, 0.25 milligram. And this is the oldest drug in this category. It is derived from the Rowofia plant. Rowofia plant. Effect: it lowers moderately high blood pressure. It is rarely used by itself, usually used with diuretics. So that is being combined with what diuretics. Side effects are drowsiness, diarrhea, nausea, dry mouth, dizziness, headaches, depression, muscular aches, temporary temporary impotence, high weight gain, rash, and rash may occur. So we want to look another category. Want to look at another categories of what do you call it? Cardiovascular agents. As their names indicate, these drugs lower blood pressure by opening up or dilating arteries. These drugs lower blood pressure by opening up or dilating arteries, thereby facilitating blood flow through them. Facilitating blood flow through them. So vasodilators are rarely used as initial therapy and are usually prescribed along with other drugs such as a beta blocker and diuretics. Beta blocker and diuretics. Some produce a very some produce a very rapid reduction in blood pressure, especially when administered by injection. So, thus, they may be useful in treating a hypertensive crisis. For chronic use, several office visits may be needed to fine-tune the dosage. Side effects may be annoying, and lowering of blood pressure may be less when these drugs are used initial treatment. So most of the time, as earlier said, that uh, that uh, I mean, some produce a very rapid reduction in blood pressure by when administered by, uh, by injection. But thus, they may be useful in treating hypertensive crisis. Most of the time, they are being used during hypertensive crisis. Then, for chronic use, several visits may be needed to fine tune the disease. So, side effects may be annoying, and lowering of blood pressure may be less when these drugs are used initially as treatment. So examples of miscellaneous vasodilators are adrenaline, that is ampicillin. This is one of the common, uh, what do you call it? Common uh, vasodilator that we have around. So, and most of the time, so most of the time you find it in many facilities, especially at the various departments where hypertensive patients are being managed. So, and the adrenaline have been supplied in tablet form of 10 milligram, 25 milligram, 50 milligram, 100 milligram, then injectable form in injection form of 20 milligram per mil, or in ampoule, per mil ampoule. Then description: an antihypertensive and vasodilator introduced in the 1950s. Effect: it lowers moderately to severely high blood pressure. So, so sorry for the. Sorry for the distraction. So, the possible side effects. Side effects include nausea and vomiting, headache, dizziness, and irregular heartbeat. Less frequently, loss of appetite, rash, flushing, or joint pains will occur. Long use of adrenaline can cause drug-induced lumpers, especially in people who metabolize the drug slowly. Tendencies that can be determined with a blood test. Symptoms of lupus and autoimmune syndrome are fever, joint pain, low blood count, and inflammation of the lining of the lungs or heart, felt as chest pain or deep inhalation. Dosage: 50 to 100 milligram daily, generally up to a maximum of 200 milligram uh, per day. So, and another example is minoxidil, that's Lolitel, and it's being supplied in tablet form of 2.5 milligram, 10 milligram. Then description: this antihypertensive and vasodilator is never used by itself, usually used with a diuretics and other drugs. They are not always being used alone or in isolation. They are being used in combination with what? Diuretics and other drugs. And the effect of these are in combination. It controls dangerously high blood pressure, and pressure that is rising very rapidly. Positive side effect: it increases hair growth, especially on the face, because on the face and the back, etc. Other common side effects are fluid retention and shortness of breath. Dosage is 5 milligram to 20 milligram per day. Note: it is always prescribed with a diuretic and often with a beta blockers. Because of its side effect of increasing hair growth, it is now available in a solution to treat badness, that is Rogaine. So, and this has bring us to the end of today's lecture. And I want to believe that you've been able to learn one or two things, and especially some of the mode of actions, and some of the important information that you need to know about these drugs. So, in summary, we have been able to discuss the digitalist drugs, and we've been able to describe what diuretics are, and as one of the agent of as one of the cardiovascular agents. Then we have looked into nitrate and their examples, and the peripheral adrenergic antagonist, and lastly we dealt with a dilator and combination of drugs as a cardiovascular. Thank you so much for listening. Uh, we shall meet the next time for the next study section. Thank you.